The functional movement system is a series of 7 movement screens that require a balance of mobility and stability. The purpose of the screens are to address the foundations of the fitness pyramid, functional movement. These 7 movement screens are the fundamental movements or foundation all athletes must have in order to maximize their chance of success and to steer clear of injury. This careful rating and ranking of movement allows the evaluator to determine areas of movement deficiency by placing athletes in positions where weakness, imbalance, asymmetries, and limitations become noticeable. Athletes are masters at hiding compensations. Therefore, it is not uncommon for athletes to be able to perform a wide range of physical activities that seem impossible to some, yet are unable to efficiently execute the movement in the screen. Scoring poorly on the screens means compensatory movement patterns are being used throughout every activity they participate in, resulting in unnecessary wear and tear on the body and eventual injury. The current data from the FMS states that if an individual falls below a certain number, they are at more risk for compensation injuries. By having a valid and reliable system in place to rate functional movements, it is now possible to identify weak links in a movement pattern. By identifying these weak links, exercise prescription can be given to an athlete to address their specific needs. By addressing the athlete's specific needs and building a solid fitness pyramid foundation of efficient functional movement, athletes are able to give themselves the best possible opportunity to optimize performance and, most importantly, remain injury-free. To put it clearly, the purpose of the movement screen is to identify people at risk for injury, design a fitness program by systematically addressing the athlete's movement dysfunction with corrective exercise and hands-on intervention, and finally, to provide a tool to monitor progress effectively in the presence of changing fitness levels.
Hey everyone, I'm Alicia DenHerder, and I'll be presenting on the reliability of functional movement screening. We're going to talk about its applications, and I'll get to my outline right away. So we're going to start by talking about injury, the prevalence of injury, especially in sports and athletes, the risk of injury, and ways that we're going to be able to fix that. Injury prevention, so things we can do to prevent injury in the future. We're going to talk about the background and the history of functional movement screening. So what is FMS, who started it, and when was it started, the 7 different exercise tests that make up the functional movement screening, how has it been used in the past, and we're going to talk about the importance of FMS, functional movement screening, and exercise physiology, what previous research studies say about FMS, so the reliability, predict that validity of functional movement screening, and if it could be applied in athletes or elsewhere, how they can be used, so like I said, in different athletes, and we're going to talk about the conclusion, a take-home message, what can we do with these things, and how we can do functional movement screening in the future, and what clinical settings we can use that in. The purpose of this presentation is to describe what functional movement screening is. Like I said, it's application for identifying injury risk, and therefore the role of functional movement screening and injury prevention. And the second purpose of this presentation is to use the previous literature to assess the reliability and the validity of functional movement screening. So an introduction here, there are more than 10,000 Americans that seek medical treatment for recreational, sport and exercise related injuries every single day, as said by Tehan et al. All sports pose a risk for some sort of musculoskeletal injury. Nowadays, ACL injuries are very common. Shoulder dislocations, all of these different things are very, very common in sports, and we're always going to have that risk for it. But how can we start to doing something to prevent this injury risk? So some background, functional movement screening is a screen tool used for injury risk assessment. It's going to evaluate an individual's movement patterns, functional movement patterns, and assess mobility, stability, flexibility, and a lot of things that we'll talk about later on. Gray Cook and Lee Burton. Gray Cook is a physical therapist, also has a certified strength and conditioning specialist certification. Lee Burton is a doctor and an AT. They both created functional movement screening in 1995, and they've refined it over the years, done a lot to make it better as far as more athlete prone. What can we do for functional movement screening to make it better to assess athletes specifically? So, importance of functional movement screening and exercise physiologists. Using this tool, we can, as coaches, potentially understand athletes' movement better, how they're moving in that sport, and if there are issues with those movements, being able to have corrective exercises to make them better and maybe better or more elite as an athlete. We're going to use this knowledge to build more effective training programs in that sense, and potentially physical therapists in a rehab setting, using those corrective exercises to do a rehabilitation program and work with the athlete better in that way, and potentially reduce risk for injury and reoccurring injury. So certification for functional movement screening, there's two different types. There's level 1 and level 2. Level 2 is a more applied certification. You're going to be more using these things that we learned from the functional movement screening to build advanced corrective exercises. Level 1 is more so just to gain a perspective on movement and learn how to administer the movement screening. So there's two different levels. You do have to be certified in order to do functional movement screening testing. So what is involved with functional movement screening? There are 7 different exercise tests that are involved with functional movement screening. We have the deep squat, the hurdle step, inline lunge shoulder mobility test, an active straight leg raise, trunk stability push-up, and a rotary stability test. Each test is scored from 0 to 3, which we'll talk about later on, what that kind of determines for each of these tests, with a total maximum score of 21 on all 7 tests, which somewhat is very unlikely to score 21 on these as a cumulative score. So here's a picture of all the seven different exercise tests. Up in the corner, the left corner, we have A, which is the inline lunge. So that's just basically doing a basic lunge. You're going to be holding a rod behind your back with one hand near the neck and one hand near the lower back. Feet should be pointed straight forward and in line with each other until your back knee is going to hit the floor, and it should be right behind the heel of the other foot. So this test is used to screen ankle and knee stability, as well as abductor and adductor weakness. Test the body to decelerate, change direction, core stability, and hip ankle mobility. These can all be important for a lot of different sports. B is the hurdle step. So as you can see here, he has his foot over the beam right there, I would call it. And we can use this, for this test, they're using, as you can see right here, this red on both sides. We've got a stick. We're going to have that at a certain level. Based on their height, you're going to step over a hurdle that is below knee height. And while holding the rod across your shoulders, you're going to step over with one leg. And you do this on both sides as well to see left and right. So this is an important test for any athlete that has quick acceleration movement. So maybe in hockey or football. It's a primary movement pattern of basic stepping functions of the human body. And we're going to look at balance, stability, keeping alignment between the hip and the pelvis is what they'll be looking for in order to give a 3 on this assessment. Keeping the upper body in a neutral position and shifting in level of the hip are all things that we would look at for the hurdle step. In C right here, we have the deep squat. We're going to hold a rod directly above your head and keep your hands and your arms in place and squat as low as you can, while keeping your upper body as vertical as possible. So the deep squat is looking for the upper torso to be parallel with the shins and for the knees and the rod to be aligned with the feet. Torso needs to be upright as well. That's what we'll be watching for when we do this test, and the thighs must be below parallel. So some of the things that we'll look for as well is good alignment between the ankles, knees, and hips, and looking for any asymmetries between these joints. And then D over here in the left corner is the quadrupled rotary stability test. So you're basically going to get down on your hands and knees. You're going to raise your right arm and your right leg until they are parallel to the floor. So for this test, we would also do both sides. It's always going to be the same arm with the same leg, so right and right, left and left. You're going to then touch your right elbow to your right knee, and so kind of this motion, but obviously you're going to be on all fours. And what we're looking for here is stability of the core and looking for any asymmetry Also looks for reciprocal movement patterns of the arms and legs, which are definitely used in daily activities and in a lot of sports. And like I said, looking for good stability but balance and control as well. And here, E, we've got the active straight leg raise. So you're going to be laying on your back and you're going to raise your left or right leg on this one. We're going to do both sides as well. Arms are at your side. You're going to raise one leg as high as it can go without bending the knee, and that's something that they would be able to look for in any issues with that, while leaving the other leg on the floor and not lifting that up at all. So the test is looking for the angle of the raised leg and where you can, as far as you can go without bending that knee. And if it's bent, looking for the alignment of the ankle in relation to the mid-thigh. So this is used to screen hamstring and calf flexibility, core stability, and hip and pelvic mobility as well. So F here is going to be our shoulder mobility, is what we're going to be assessing for. So basically you're going to make thumbs in fists and put both hands behind your back at the same time. So for that shoulder mobility test, we're going to have one arm coming up from the back and your other arm coming up from the side and behind. And we're looking for symmetry between both sides and how close together your hands are when you do that motion. So kind of a flexibility thing. So with this motion, you're going to look for hand length. So basically you would measure your person's length of the hand before you do the test. One hand length between is going to yield a perfect score, so not very much space between that motion. Is going to be 3, so 0 to 3. It's going to be perfect score at that 3. 1.5 hand length would be 2, and 3 would be 1. Any pain with this motion at all would be 0, as well as with any of the other exercise tests. If any of these you're experiencing pain during, you automatically get a 0 for those tests as well. So with G here, we have the trunk stability push-up. Right here, you can see there. For males, they usually start up at the forehead level, and females are going to be more at that chin level. Starting, if you can't perform it at the forehead level as a male, they usually push you down to a chin level. That would decrease your score a little bit, probably from a 3 to a 2. If you're able to do it at the chin level perfectly as a male, you should still be able to get that 2 score, unless there's other issues with that movement. So this test is looking for the ability to engage the core, keep the spine in a flat position, and core strength, and we're looking for any spine sag. So those are the different 7 exercise tests, and all of these, like I said, are using, we're using those tests to determine flexibility, stability, core strength, all of these things. So what does the research say about functional movement screening, its applications, and what it can do to prevent injury as far as assessing the risk of injury in athletes? So one of our first studies we're going to look at is Tehan et al. From JSPT. In 2012, they completed a reliability study of the functional movement screening with active duty service members. I thought this was a very interesting population. As far as I'm concerned, obviously functional movement screening can be used or utilized in very many settings. Preventing injuries in this population, I think, is even more important though. Like I said, we would like to look at athletes specifically for this presentation, but for the active duty service members, it is very important to look at that injury risk and preventing injury. Having to take these active duty service members out of their service is a very poor thing to do. What they did is the study tested the reliability of functional movement screening by examining the consistency of a single novice rater's scores for the same subject. So that's going to be the intra-reliability. The study also tested reliability of functional movement screening by examining subjects' scores between novice raters, so inter-reliability. And these are the things that they use to determine the reliability overall for functional movement screening. Among novice raters, the functional movement screening composite score demonstrated moderate to good inter-rater and intra-rater reliability with acceptable levels of measurement error, so not much error. This is a very interesting way to review functional movement screening and its reliability, I think, but it is important to know the differences between people and their scoring capabilities. So is it going to be the same between one person and another? And as I said, all of these are at a novice level. They were physical therapy students active in PT school, and they were all trained with functional movement screening. Another research study used a military population as well. It seemed to be kind of popular. There is not much research on functional movement screening. It is something that still needs to be researched a lot, which I'll mention in my conclusion as well. Leisman et al. Did a study and to test the reliability as well for functional movement screening and predicting injuries in a military training. So they all underwent functional movement screening tests during medical in-processing. Had the same people do the screening as well for this one. So the candidates with a lower FMS score were at a higher risk for any injury, and FMS score that was less than or equal to 14. So remember that total score is 21, 3 at the utmost for each test, 0 to 3 range. So less than or equal to 14 acts as an independent injury predictor. So that means basically they correlated injury risk with that lower 14 score. But with the PFT, they used as well with this study a 3-mile run to determine kind of that injury risk and look at times. As these were combined, they worked together as a strong predictor of injury as well. So I think that more research should be done to clarify what combination of PFT and functional movement screening would be best for predicting injuries. So maybe pulling some of these functional movement exercise tests, only some of them, and this could potentially use criteria to develop appropriate and effective pre-OCS injury prevention training programs. So another study, Durrell et al. This was a systematic review and meta-analysis, which I actually found a lot of research within, just based off of what studies they used and talked about and all of their references. It was very helpful in the fact that there is not much research on functional movement screening already. So they used it to determine the prognostic accuracy of functional movement screening, so that kind of reliability and validity of it. 7 studies included. They started I think with 15 and they narrowed it down based on which ones they thought were best fit for this kind of meta-analysis study. So that FMS was more specific than sensitive is what they concluded with this meta-analysis. Basically what that means is the specificity is the ability of the test to accurately classify those subjects who score over that cut score, and sensitivity is the ability of the test to accurately classify those subjects who scored on or below the FMS cut and sustain injury. The positive predictive value is the likelihood that a subject with a positive test actually has that target condition, and their positive predictive value was 42.8%, and their negative predictive value was 72.5%. That negative predictive value is the likelihood that a subject with a negative test is actually negative for that target condition as well. So this definitely did show a lot of different things that we may not have seen in individual studies about functional movement screening. It's really good to find a meta-analysis of something like this that does not have much research on it already. So basically compositing all of these journal articles that have already been published in studies on functional movement screening and seeing what that validity and reliability is. So based on the overall analysis of the current literature that we have for functional movement screening, the findings do not support the predictive value of functional movement screening. We'll see later on as well that a lot of individual studies did see positive things with functional movement screening and its ability to predict injury, but overall with this meta-analysis they did not see that. So they did not see the support for the predictive value of functional movement screening. They believed that was due to methodological and statistical limitations that kind of threatened the ability to kind of determine that predictive validity of functional movement screening. So those are some things that we'll talk about later and what we can do after we've looked at all of this research. Another study, DenHerder et al. In the Journal of Strength and Conditioning Research investigated whether preseason FMS scores could predict serious running injuries during the season in 18 to 24-year-old competitive runners. So very prevalent here. I know I'm a runner, a lot of runners predicting that injury, I've had a lot of issues with my knees and Achilles tendon. So being able to predict whether, those functional movement screenings, maybe I have issues with some of them, if that's going to help us predict any injury for the future, and being able to correct those exercises so that I can make my movements better in running. So functional movement tests performed, preseason and follow-up surveys were distributed to subjects to investigate the incidence of injuries during that 6-month season. So 2 surveys were at 4 months, so within that 6-month season, and 1 was at the end of that 6-month season. There was a trend for the injury group to have lower FMS scores. It wasn't significant, but there was a trend. When they looked at just the active leg raise and the deep squat functional movement scores, there was a significantly higher injury rate seen in subjects with lower functional movement scores. And combining some of these functional movement screening exercise tests may see significance as well. So noting that maybe not as a whole functional movement screening, as we've seen in that last meta-analysis, that would fully predict injury or be the best to predict injury, but maybe some of these tests, at least, we know that they're going to predict flexibility and stability and all of these things as well, and making sure that those athletes aren't making movements with compensations. Another study, Chorba et al., they use FMS to determine injury risk in female collegiate athletes, so very common here as well. And we know that ACL injuries in female soccer players are very prevalent. Compensatory movements used by college athletes to achieve high performance, which causes inefficient biomechanics and can increase risk of injury due to those inefficient biomechanic movements. Functional movement scores were calculated for collegiate soccer, volleyball, and basketball players. Preseason, injury occurrences during the seasons were recorded as well. The mean FMS score was 14.3 with a standard deviation of 1.77. 18 injuries were recorded during the season. A score of 14 out of 21, so that total score of 21 or less was significantly associated with injury. So 69% of athletes scoring 14 or less on all of these tests or less sustained an injury during the season. So of those 18 injuries. So what they concluded was that compensatory movement patterns can increase the risk for injury. So knowing if an athlete's using compensations to do some of those movements, maybe in this trunk stability push-up or an inline lunge, and knowing those differences in, they're not maybe as flexible as they could be within their sport and things like that. So they definitely can identify these with the functional movement screening. O'Connor et al. Evaluated the efficacy of functional movement screening to predict injury in a large military cohort. Like I said before, military population and active duty seem to be very, very common. So it's kind of interesting to see those populations used for this type of research. Functional movement screening performed during the medical in-processing as well as before with one of our earlier studies. Subjects were then enrolled in either short circuit or long cycle training, and they were followed up for injuries occurring in training. So this training for military people can be very harsh to the body, and injury could happen very well. So knowing whether this injury can be predicted or not is very valuable. The mean FMS score was 16.6, and for the long circuit, 8.4% of those had a score lower than or equal to 14 on the FMS scores, and the short circuit had 12.8% that had these scores below 14 or equal to. So candidates with an FMS score lower than or equal to that 14 had a 1.91 times higher injury incidence rate compared with a score that was above 14. Lower percentage of the group had scores less than or equal to 14 compared to other studies. That could be a limitation within this study, is maybe that they had a lower percentage of that group, their total group, in a large cohort of military people that had a lower score. Maybe the majority were much more fit. So that could be an issue with predictive value of the data. To conclude as well for all of these research studies and a take-home message. So 7 different functional movement screening tests I think they can evaluate athletic ability based on those different types of tests and how they evaluate compensations in movement, flexibility, core stability, strength, all of these things, and in that said, can predict injury in some ways and to some extent. Although we have that meta-analysis that may not have seen that, there is further research that needs to be done. As I said before, there is not much research done on functional movement screenings. I believe that functional movement screens have shown to indicate the risk of injury, but the scores did between studies as far as the 14 versus the 17 score out of 21. And as I said, more research needs to be done, maybe to compare FMS scores between age and sex and maybe athletes with different injury histories as well. So like I said, testing the efficacy of functional movement screening is an ongoing process, and I think that we can do a lot to continue that research, maybe even pairing functional movement screening research with another test such as the wide balance test. That is my presentation on functional movement screening. Here are my references. If anyone has any questions about functional movement screening, I have much more to talk about.